dental health for your pets. So we're honored to have our guest speaker here with us tonight, Doly Baquero. So Doly is a doctor of veterinary medicine, and she graduated from the University of Llanos in Colombia in 1997, and she has 22 years of experience in small animal medicine. She's a USDA Accredited Veterinarian, and in the aspect of her job, so let me back up a little bit so I don't go too fast with her. She is the owner of a beautiful new clinic on 152nd and US 1 in Cutler Bay. It's actually Palmetto Bay. It's called the Falls Animal Clinic. And the aspect she values most at her practice, besides offering the practice of best medicine for your clients and her patients, is being able to work with a great staff and support team, which is, it's dynamic, because without that staff, you can only do so much. She feels that having a dedicated staff gives her the ability to save lives, which is most important and most gratifying part of everyone in veterinary medicine. So I'm gonna turn it over to Dr. Baquero, because I'm gonna say her name right. I try to anyways, but please introduce Dr. Baquero.
Hi, good afternoon. My name is Dr. Baquero. I'm the veterinarian in the Falls Animal Hospital, which is this hospital that is located in Palmetto Bay. A pleasure to meet you guys. And today we're going to talk about dental care for dogs, which is something that it is important. Is a care that if we do it for the pet, it will extend to his overall health. It will help with his liver, his kidney, and the other organs. So I'm going to start with the first slide, and we're going to talk about why care about the dental health. Poor dental health can affect the pet's overall health, longevity, quality of life, and interactions with the owner without exhibiting obvious clinical signs of the disease. So many pet owners think that their pet's teeth are fine, but about 2/3 of adult pets have some form of periodontal disease. This is a painful infection that can ultimately affect the liver, the heart, and the kidneys through the spread of infection into their body. Let me put a little slide so we can do a little talk about it.
Frankie, you're showing your chat. There you go.
Periodontal disease is associated with poor health. There is an association that has been shown between periodontal disease and systemic health parameters, and this is done in human medicine. The presence of chronic inflammation is associated with periodontitis, has been recognized to likely negative impact overall systemic health. Those studies are making humans, but we can extrapolate some of the information that we get from them to the veterinary field. The systemic spread of inflammatory mediators like cytokines and bacterial endotoxins from the periodontal pathogens can impact the vascular system through the body or even cause histological changes into the organs. The management or resolution of the inflammation associated with periodontitis is likely to have a greater clinical impact than just considering the bacterial efforts. Through evidence, they have been demonstrated a direct correlation between systemic disease and oral and dental infections. May be difficult to prove, but we have been seeing positive impacts on patient quality of life, can be often clinical demonstrate, and has a wide experience for that. So I'm going to show the next slide, and in the next slide, we're going to see a picture. This is something that we usually see in dogs. Sometimes when the owner see the dog, is just a little bit of the redness, and we can see a little bit of the tartar. And this is important that at this point we start thinking about doing some dental care for the animals. At this point, you may need a little bit more help from your veterinarian to do like a fresh start, because we will have to help you But once we do the cleaning, there is a lot of things that you can do at home to help to maintain the teeth in a good condition, so we can spare out the amount of dental cleanings that you will have to do for your pet. Let's do the next slide. Periodontal disease. Let me talk a little bit about some of the things that we have to look when we are talking about periodontal disease and gum disease. It's not an uncommon disease, and what you will see in this disease is plaque. Plaque is a small film of bacteria and food debris that accumulates every day and stick to the surface of the dog's teeth. The mechanical force of brushing easily removes plaque. If plaque is removed daily, a dog's teeth and gum will stay healthy. And this is the initial stage of when we have a disease in the teeth. Then the second part will be that if the plaque remains stuck into the surface of the teeth, mineral found in the saliva will harden the plaque into calculus, and then this will form something that we call tartar, which is firmly attached to the teeth. I would not recommend you to try to remove it. You remember in the last slide we were seeing some kind of brown material that it was stuck to the teeth. It would be something that I wouldn't recommend you to try to remove it at home or to try to scratch it off, because sometimes when you try to do that, you may be able to fracture one of the teeth. Because what you see outside, if you remember in the slide, we were having the brown coloration in the teeth, but we're also having a little bit of the red color around the gums, because sometimes the tartar can be also underneath the gum line, and we wouldn't see it. So if we try to remove it, then we can do more damage than good for the animal. Then the second step will be gingivitis. When the tartar start digging into the below the gum tissue, the gum will become red, irritated, and inflamed, resulting in a condition that we call gingivitis. And once the tar has dug into the gum line and create gingivitis, the plaque bacteria are constantly being introduced below the gum line. That will result in a degree of gum infection, and that could help the animals to develop something that's called periodontitis, which is the plaque bacteria below the gum lines. When we have bacteria below the gum lines, this bacteria can create toxic substance that it will damage the gum, but it also will cause damage into the bone structure that it will support the teeth. Also, we will have some infections. So the bacteria will cause an infection in the area. So we will have more of the white blood cells of the immune system of the dog going into these areas. That will cause more inflammation. And at the end, we can result having a little bit of the access for a tooth, which is an accumulation of pus or a lot of white cells that they will be located inside of the gums and into the bone side, which is holding the tooth. When that happens, then you have a dog that develops a tooth access. And usually when it's a tooth access, because of the infection being in the bone, then you will need to have a veterinary care for that. And we will have to do a dental cleaning, take some x-rays to be able to evaluate the bone around the root. And then most likely those teeth will need to be extracted because of the process of the periodontal disease that the animal has been having. It's also because of the inflammation and the loss of the gum around the tissue, there is not enough blood flow for those teeth to be healthy. So it's a good idea to try to prevent to develop a tooth access, and we can do that through some home care and some veterinary care. That's the main point for this. Let me go to the next slide. So the next slide is we're going to talk about beginning signs of periodontal disease. So the beginning signs for periodontal disease is most commonly we will see difficult eating. We will notice that the pet will chew the food to one side of the mouth and don't use the other one. Sometimes they can drool. Sometimes they are eating and they will let the cable come out of the mouth. Sometimes they will try to introduce the paws inside of the mouth because of the discomfort. In some cases, we can see discharge from the nose. Sometimes they will be drinking water and water can be coming out of the nose. It's common to see inflammation underneath the eyes, especially when they develop access to the third premolar is something that we commonly see. The most common one is bad breath. Always when we see dogs that they have bad breath is something that we should take into consideration because it could be related to his teeth or it could be related to some underlying disease in his gastrointestinal tract. So it's a good idea always to try to check what's going on with him when they have bad breath. Tooth discoloration or visible tartar is something that we, as we see in the picture, it should be addressed when we see those changes in the teeth. Also, when we have red gums, gums that are bleeding, or when the dogs start losing weight or lost their appetite, we should try to see if those could be related to the stage of his teeth and if they have any kind of gingivitis or inflammation in the mouth that they cannot eat. Then we have more advanced signs. Can you show the other slide? So when the animals have a periodontal disease and is not being controlled, it becomes a little bit more complex for them. And then we will see redness or bleedings from the gum. We will see that when they chew toys or they chew any element, those will have blood. Some they can have a little bit vocalization, they can yawn, or when they eat, they can cry a little bit because it's painful for them. Some of them can lose the teeth, they can be eating and the teeth just fall. They can also have a little bumps and lumps in the mouth, or it could be in the areas outside of the mouth, inflammation of the gums or inflammation of the lips. Sometimes you can see a little bit of the saliva coming out with the blood. And sometimes they don't allow you to touch the head because they are painful around the mouth area and they don't want you to pet them or touch the mouth area. Can you put the next slide, please? So this is like the early signs of periodontal disease. And this is when especially we have a pet that is young, we should start addressing dental care. Because if you see, we have a lot of tartar, and a little bit of the inflammation in the gums, but it's not something that it has a lot of damage. So it's something that with a veterinary care and some good house plan for caring at home, we can improve the situation. And in the long run, when your pet get older, it will have a lot of benefits for you because he wouldn't have any systemic disease and he will have a very good overall condition for his enamel and the teeth. Okay, let me see the next slide. We're going to talk about treatment options. So professional cleaning care and home care. So for professional cleaning care, usually it's up to the breed, the age of the pet, and the kind of care that you do for them at home. But sometimes we recommend to do professional dental cleanings every 6 to 12 months. And those we recommended to do it under general anesthesia. So we can have a proper cleaning and a proper evaluation of the tooth. Yes, for home care, the ideal is to do some home care daily for the teeth. But sometimes I know it's a little bit difficult for you guys to do like everyday brushing. So there are some studies that show that if you do at least 3 times a week cleaning for the teeth, it will be adequate. It will help you to kind of slow the progression of the disease. But if you wanna be you are be able to extend the dental cleanings or the period between the dental cleanings, the timing. If you clean it every day, that's going to help you a lot. And we can reduce the amount of dental cleanings that you can do in a year. Brushing is very important. The other thing is try to remove the plaque. And also, as I explained to you, it's ideal to do some prophylactic care at least once a year. Or some animals will require 2 times a year. Some other breeds will require 3 times a year. Anyway, just talk to your veterinarian because they know your pet they have been treating your pet, they know what kind of breed he is, and other underlying conditions that he can have that will predispose him to have more dental cleanings that they have to be more often, especially when they have some sort of kidney disease or heart disease. They will require to have a little bit more dental care than a regular pet that is healthy.
May I ask a question?
Yes, sir, sorry.
With these two pictures that you have up here, if you start with the top picture and if you brush your dog's teeth 3 times a week, do you have a good possibility of
with the top
with
picture?
The second picture?
With the top picture, no, because unfortunately in the top picture, if you see, they already have a little bit of the inflammation and we see that the tar is already established. If your veterinarian do a dental care, do a dental cleaning, take some x-rays, make sure that the roots of the teeth are okay, check if they have any pockets, because sometimes the tar you see it outside of the teeth in those pictures, but sometimes when we're doing the dental, the same brown material that you see, it will be inside underneath the gum line. And that has to be removed. The other thing that we evaluate when we do dentals is we measure how big is that space. We call it pockets, and we evaluate how big those spaces are. And there are some special medications like Doxyroll or Clindoral that we can put into those areas to help them to reduce those space to have a very good gum line. And then if you do your care at home, you can have a picture like you are seeing in the bottom, and it will help you to maintain it for a long time, longer than the usual if you don't do anything else, you know. That's
Thank you. And did you say that you recommend a dental cleaning with a veterinarian once a year? Is that what you said?
It's up to the breed and it's up to the conditions, the health condition of your dog, but usually we will recommend it once a year. As I explained to you, your veterinarian will have the x-rays done from before, the blood work and whatever it is that he did during the dental before, and he can give you a better perspective for that. But at home, you can do other things to kind of extend that time. And things that you can do is brush the teeth, use some additives to the water. Even there is even some diets that it can be recommended if you want to do like an extended home care for dental cleaning. There are some special diets in the market for that. As I explained to you, it's more like once we have the evaluation or your veterinarian has the dental done, did the x-rays, and did an evaluation of the mouth of your pet, he can recommend you which ones will be the best options of treatment for your pet, and which ones are the ones that are going to helping you to extend the time for the dental cleaning, you know, because that's what we're looking for, you know. Can I see the next slide? So we're going to talk about option treatments for the pets. So usually what we recommend, as we were talking before, is the ideal for a dental cleaning is to do it under anesthesia. Is good for the pet because he's going to be, is more safer because he's not going to be restrained. And I know a lot of people is a little bit hesitating when it comes to anesthesia, but there are some studies that show that anesthesia is very safe in healthy animals, and the mortality rate for those studies are between 0.05 to 0.15. So which is really low, and we're talking about healthy pets that they are going to have a dental cleaning done. If your pet has any heart condition, any kidney condition, then we will have to do a little bit more testing and see what is the condition of the animals, and maybe some pre-medications before we go and do the dental cleaning for them. As we were talking about it, during the dental cleanings, we do some probing to check for pockets inside of the teeth. That's important because what these pockets mean is the tartar has been growing underneath the gum line. When that happens, the tooth starts losing the blood flow from the gum. And because of the lack of blood flow, that's how you develop root access. That's how they develop root access. So it is important in the early stages, if we can clean underneath those gum lines and use antibiotics and different medications that we help this gum to be healthy and to be stable and we don't lose it. That's going to help in the long run because we wouldn't have to do extractions in the animals and they will have a better quality for the teeth. The other thing that we check is the mobility of the teeth. Remember, we are only seeing the teeth, 60% of the tooth is inside of the gum line. only 40% is outside. That's the reason that we need to do X-rays to be able to evaluate what is the condition of those tissues, the bone, if they have any kind of abscess or if they have any gum disease underneath. Sometimes you can have fractures, sometimes you can have a loss of the mineralization of the bone around the teeth, and those can be evaluated through X-rays. And that is going to help the veterinarian to do a better decision when it comes to, as I explained to you, treatments that we can do locally or treatments that we can do systemically. Or sometimes I have been seeing pets that came and you see the tooth upsize and it looks normal, but when we do the X-rays, we found that they have infections in the roots, so we can remove it before they become osteomyelitis for them. Usually when we do dental cleaning, we use something that is called the cabandro, which is spraying water on the teeth while we're using the ultra cleaner, the ultrasonic cleaner to remove the tar out of the teeth. And we do that in the part that is visible, but we also go underneath the gum line and clean those areas. And that's good, because if you only remove the external part, then you're not doing any treatment for the gum line. So even though it looks beautiful and it looks clean, in reality it's not, because what is going on, the tar that is underneath the gum line, you will not be able to see it, but they stay there. And this is the one that cause the most damage, because those are the ones that will reduce the amount of blood flow, will cause infection in the bones, and at the end, that's how we ended up having an abscess in the tooth. The other thing that we do is because we do the dentals during anesthesia, we usually put an endotracheal tube in the pet to be able to provide anesthesia. We usually, for dental cleanings, the majority of the veterinarians will use gas anesthesia, which is pretty safe. We can control it in a very good way. And the endotracheal tube has a part that we can inflate, and in that way we can prevent that the water will go to the lungs of the pet while we are doing the dental cleaning. Also, the water will help us to remove some of the tartar that we remove with the scaler, and he's not going to swallow any of those particles of the water that is contaminated with the bacteria that he has in his mouth. As we were talking before, during the dental cleaning, especially if they have some areas of inflammation or if they have pockets, we can use some topical antibiotics that they can be in the area for up to 3 weeks, which is important. And then, as we were talking, once we do the dental cleaning and we have the gums evaluated and the gums are in a good health and the teeth are completely, we remove the tar, we polish the surface of the teeth, so the tar is not going to adhere so easily for the next time. And then after that, we will recommend you to do some home care, that it could be do with the brushing of the teeth or applying some other products. It's up to how your pet allowed to touch his mouth and to do work for him, you know, is part of the training that we have to do for pets when they are really young. Let me see the next slide. We're going to talk about non-anesthetic dentistry. Non-anesthetic dentistry is something that is becoming common, popular for people to do. Some people think that it's a little bit more safe because they doesn't include any kind of anesthesia. It's less expensive, but as we were talking about it, sometimes when they do that kind of cleaning, they are only doing some aesthetic treatment. They have been removing only the external part of the tar, but they cannot do any treatments for the underneath gum line. The other thing is when they do those kind of procedures, they don't take any dental X-rays for the pet. So it's very hard to be able to evaluate what is the condition in each of the teeth that the pet have, because we cannot do any X-rays. Sometimes the way that they do the cleaning, remember they don't use any water, so the dog will be swallowing all the tar and all the debris that they are removing from the teeth. Also, they have to restrain the animal somehow. Remember, some dogs wouldn't like to be touched in the mouth, so sometimes it could be dangerous for them and they can have a sustained injury because of the way that they hold the animals or the way that they have been restricted. basically it's really hard to do it without the anesthesia, to do a proper job for the animals and to remove the plague in the way that it should be done. And sometimes when they are trying to using the instruments in the animals, those instruments can cause trauma or lacerations into the enamel. So the animal is going to be more prone to develop plague in the future. Also, they don't do any polish for the teeth because they cannot polish the teeth. That will make the surface a little bit more rough, and it will be more easy for the plague to come back for the next time. As I was explaining, that's basically the difference, that they cannot do any kind of evaluation to be able to see how is the tooth underneath the gum line. And it's very basic what they can do when it comes to the cleaning without the anesthesia. Now we're going to talk about preventing at home. Can you go to the next slide, please? Okay. What we can do to prevent as we were talking about, what we can do at home to extend the time for us to do the dental cleaning is a lot of things that you as an owner can do. One of the first things that we should talk about is a toothpaste. A toothpaste, usually we will have to use a toothpaste that is recommended for pets, not for humans. Two reasons. One of the reasons is the human is a toothpaste that is not designed to be swallowed, and it can have some components that it can be toxic for the pet. The other reason is the flavor. Usually, toothpaste that is designed for humans, it tend to have a mint flavor or some kind of refreshing flavor, which it can be a little bit overwhelming for pets. And they usually swallow the toothpaste, so it's better to have a toothpaste that is designed for pets. The toothbrush also, we should use toothbrush that are designed for dogs. They need to be a little bit soft, and the design is also different because remember, the mouth of the dog is completely different and it's smaller than ours. So we have to try to use a toothbrush that is designed for the mouth of the dog or the cat. Or it's different if you have a little dog or if you have a big dog, then you have to look for the right tool to brush the teeth. Another thing that we recommend is when you are planning to start doing the cleaning of the teeth, it's a good idea to introduce the toothbrush to the pets first. But when you do that, try to walk him first, try to play with him so the dog will be calm and relaxed. So when you try to do the brush, introduce the brush and to use it to touch his canines, he will be more compliant with that. He will be all energetic, he will be calm and relaxed. So it's going to be a good experience for him. Because once you start trying to brushing the teeth of the dog, they have to associate the brushing with something good, not with something bad. And it is important to do like a period of training for them. It's something that you have to do little by little and step by step until the pet get comfortable with you putting the toothbrush and with you touching his teeth with the toothbrush, and he doesn't matter that. And then once you have that part done, then you can try to introduce the toothpaste. Usually the toothpaste come in different flavors like chicken, fish, or beef, or Malta, which is flavor that they usually like. So that's going to make them more prone to allow you to do the dental cleaning. The other thing that we recommend is just to do the outside part, don't do the inside part of the teeth, because the saliva will help us to clean those areas. And as I was talking to you guys, the most important is if you can do it every day. If you can do it every day, it's something that overall is going to help you to elongate the time between dental cleanings.
And Doctor, do you suggest, sorry to interrupt, but some people even do it like after every meal. I'm assuming that's
yes,
a little overkill.
that will be good. If you can do that, that will be awesome, because that will be it will helping the animal not to develop any plaque. Okay. And if they don't develop plaque, they don't going to have any tartar, because in the first stages they have to develop plaque. And for them to develop that, if you do the brushing every day, they're not going to do that. So it's going to be better if you can go into that respect of doing it every day. Another things that we can do at home to do for them to prevent any further complications is we can do some additives to the water. There also are some rinses that we can use for the dogs. That's what that's what we have for that part. So let me see the next slide, please. Okay, so we're going to talk about puppies. Puppies, I think this is the most important time for us is when we have a puppy to start doing the dental care. Because at first we have to, is the right time to train him to be using the brush. It's also the time because sometimes they, especially some breeds, because of the way that they are designed and the way that the head is designed, they can born with different kind of occlusion conditions, like the French bulldogs, English bulldogs, sometimes the Chihuahuas. Some of those, or Yorkies and Maltese, they can born having more, when they try to change the teeth from the decidual to the permanent teeth, sometimes they don't do that, and those teeth stay in the mouth. And if they stay, they are more prone to have food into those areas, and they can develop early signs of dental disease. That's something that is a good idea to have your veterinarian evaluating the condition of your dog mouth when they are young, just to make sure that all the conformation that he has for his teeth are proper, or if he needs to have any treatment for that. Sometimes when they have extra teeth, if we do the spay or the neuter, at that point, your veterinarian can remove the extra teeth. The other thing is, as we talk, we have to train them to get this brush. And there is another product that we can use for puppies, which is a chewable CT chews, which has, it will help you because the pets tend to have a habit of chewing. They like to chew, so it will help you because you can have some medication into those chewables, and it will help you to reduce the amount of bacteria in the mouth, and it will help you to take care of the dog in that way. And as I was explaining to you, if we can train the dog to have the brush every day, it's going to be good for his future and good for his overall health in the future. That's what we can do for them. Can I see the next one? Okay, let's talk about adults. I know sometimes people like to adopt pets. So when you adopt a pet, he's already 1 or 2 years old. So sometimes some dogs will allow you to be trained to have the teeth brush. Some you wouldn't be able. If you are not be able, there are things that we can do at home to take care of the teeth. We can use the water additives for them. We can use the chews that has, some of them will have chlorhexidine, some of them will have another components that it will help to reduce the amount of calcium, so it will help it will reduce the formation of tartar in the teeth. They also have some enzymes to help to control the formation of plaque. And as we were talking about the diets, what's the difference between the regular dog food and the dog food designed for the dental clinic? Usually those diets will have glucosamine, will have chondroitin, and also it has a little bit more fiber than the regular diet. Also, they are rich in fatty acids because all of those components, fatty acid especially, will help to reduce the inflammation. The glucosamine chondroitin will help the overall joints of your dog, but it also is going to help with the support of the teeth of the dog. The cable is designed in a way that they have to, when they chew it, they can have a mechanical action. But for the dental diets, you have to feed only the diet to be able to help your pet. You cannot mix it with any other diet. It has to be only the diet, and you shouldn't be getting the food wet. The idea is that they use the cable in the way that is set up for the for the company that they made. As we were talking about it, when they are 2 or 3 years old, the recommendation is to have a dental cleaning, or at least have your veterinarian checking the teeth once a year to evaluate whether he needs a dental cleaning or what's the treatment that he needs or he requires for his teeth. That's something that I will encourage you to do it. Talk to your veterinarian at least once a year to see how is the condition of the mouth and what it needs to be done for them. Okay, so let me see the next one. For senior dogs. For senior dogs, it is important the overall health of the teeth. As you remember, we were mentioning before, some of the bacteria that they have in the mouth can go on circulation, and it can affect the kidneys and the liver, and it also can predispose them to have some sinus if the periodontal disease is not treated. Remember, the roots of the tooth, especially in the maxillar area, are connected to the sinus. If they don't have any kind of cleaning, it's very common for me to see dogs that develop fistulas, which means it's a little opening between the mouth and the nose. And that happens because they don't have any dental care previous to that. And it's more common to see it in older dogs. So it is important to have the dog checked by your veterinarian to see what is the condition of the teeth, to be able to evaluate and do the dental cleanings when they need it. There are some benefits of the dental that outweigh the risk of anesthesia, as was what I was explaining to you guys. If they have a lot of bacteria in the mouth, that's not going to help the kidney, the liver, and the heart. Always when we do dental cleaning, especially in older dogs, is highly recommended, and talk to your veterinarian about it, but he will probably recommend you to do some blood work before we do any kind of anesthesia. Usually for older dogs, when we do dental cleanings, we put an IV catheter on them to be able to put some fluids. That's going to help with overall blood pressure during the procedures. Also, we run some fluids, and it's something that we control the temperature. We try to manage the anesthesia, the oxygen. So we try to manage all the process when they are under anesthesia to do a safe anesthesia for them. But for them, it's a little bit more important to have the teeth in a good condition, because an older dog that has the tooth in bad condition, then they cannot eat. And you're going to bring the pet in, and when we check it, or your veterinarian check it, they have an abscess. And then when they have an abscess in the tooth, what is going to happen? As a veterinarian, I'm going to recommend you have to do a dental cleaning and remove the teeth. And the kidney values in your dog are really high. But anyway, I have to put him on the anesthesia, because if I don't do that, your dog cannot eat. So it's a better idea. I always tell people the preventive medicine is the best medicine. If you can do a procedure without you being forced to put an animal on anesthesia because he has a abscess or he cannot eat, and then you have to remove the tooth. If you do regular checkups with your veterinarians, and if the x-rays are done, we can evaluate the conditions and they can be planned. The best thing for dental cleanings and surgeries is if you can plan the procedure, because then you have enough time to do some blood work, to do some pre-medications for the dog, and to do the procedure in a more safe way for them. Again,
Dr. Baquero, also with when you take your dog to the vet and they decide that it's imperative that you have a dental cleaning and maybe an extraction, and it's an older senior dog, we have monitors that we hook up to that dog that watches the blood pressure, watches the oxygen level in the dog. So we're taking every precaution to make sure that that anesthesia is safe and that dog wakes up. That's what we want. So if you're worried about that, yeah.
Exactly, that's something that is usually done. And as we were talking about it, sometimes because we are monitoring, sometimes when they have, for example, the temperature is getting low, or they have the blood pressure a little below, sometimes we can stop and don't finish it out with the procedure, and then come back in another day and finish it out with the procedure. The fact that we're doing a dental cleaning in the dog doesn't mean that you have to do all the extractions all at once if he requires multiple extractions. We can do some one day, giving a little bit of the time, 2 or 3 weeks, that he can recover from the anesthesia, and then we can go back another time and finish it out when it needs to be done. It doesn't have to be done all at once, It's up to how, like you say, it's up to the animal when we are monitoring the anesthesia respond, because we have to be taking in consideration of all the other vitals that it has to be in the right condition for him to be under anesthesia,
Right. And also the fluids that are running into him, if he's in renal failure, those fluids are going to be monitored and go in slow enough, but they're also going to help his kidneys because they're going to flush them out. And it's almost like they're getting 2 for 1, because it's kind of, they're flushing the kidneys out. The IV catheter and the fluids is going to help his kidneys.
Yeah. Okay, so let me see the next slide. Okay, we're going to talk about recommendations. This is something that you should talk to your veterinarian. I'm just going to talk in general as have been doing, but it's something that once your doctor evaluates the mouth of your dog and he does the X-rays and he knows what is the condition, we can do some of the recommendation, or he can do some of the recommendations. So what we have as we talked before, we have the toothpaste, which is important. That is a toothpaste for dogs. There is different types of toothpaste in the market, but I will recommend you something that is a flavor for animals. Don't use the human ones. And something that it will helping you to stop the formation of plaque in the teeth. That's something that is important.
It's important to get them from your veterinarian too. Dr. Baquero has some at her hospital. And
yeah, so it is important because usually sometimes the veterinary market is not kind of very well regulated, and people have the best intentions sometimes, and they put some products in the market, but sometimes the product doesn't work, or it can cause damage in the overall health of your dog. So be very careful when you approach to products online, because they promise a lot, They promise a lot of stuff for you, but in reality, when you see the benefits, I have been seeing patients that people buy stuff online, and instead of the animal being healthy, the animal ending up with kidney failure because of the products that they have been buying. The food market, the dog food market, is something that we can see right now. Everybody else is making food for dogs. And we start seeing, for example, in dogs, we start seeing heart disease again. Something that we didn't see for a very long time because they don't comply with the requirements that the dogs need for that. For cats, it's the same. Remember, the cats and the dogs now, they live in a house, they live in an apartment. The only source of food for them is the food that you're giving to them. If the person that made the food doesn't do the right amount of minerals and vitamins that they require, your pet can get sick because of the food that you are giving to them. I don't want to talk about companies or brand, but if you see there is a lot of brand food companies that they have been doing settlements because what they put in the bag is not what it is in the bag. So they have been taken to court, and if you see, they have been paying the customer. But it's something that the court will do, but it's not going to benefit you as a pet owner or me as a veterinarian, because once the damage is done, we cannot fix it, So that's why we have to try to see the companies that have been in the market for a very long time, that they have research. It is important when you buy a product, try to see if they do some sort of study, that they have some sort of information, that they can backing out what they are selling you. Because a lot of people just want to make money out of the pet, because the pet industry is becoming big and everybody else want to make money. And sometimes instead of helping your pet, they end up hurting them. So try to talk to your veterinarian, see what are the recommendations that your veterinarian have. Do a little bit of the research. See if it's any kind of study, see if they do any kind of trial for those products that you are using at home for your pet. Unfortunately, that's how the market is nowadays. When it comes to the recommendation for dental care, we have the toothbrush, we have the toothpaste, we also have some wipes. The wipes it is good if you cannot use a toothbrush, because some dogs tend to have a sensitive gums, and when you try to brush it with the toothbrush, they will not going to allow to do it that. If that's the case in your your dog, what you can do is use the wipes, because the wipes will contain the same ingredients that you can find in the toothpaste, and it will helping you to remove the plaque from the teeth, so you wouldn't have any formation of tartar. if you cannot use the brushes for the rinse. They have a lot of products that you can, again, if you cannot touch, you cannot do any manipulation on the tooth area, then you can apply some rinse on the mouth, and they will go all around the mouth, and they will helping you to again remove the plaque, because that's the idea, because that's how the whole process started. They also have dental treats that you can give into the pet, but they have to be used daily in order to be effective for the pets. Same with the wipes and same with the toothbrush. Those are therapies that at home you have to do daily. We have a product that is called Oral Bed. Oral Bed is a gel. It's a good product in the sense that we only have to put it once a week. So if you apply once a week, it's going to stay in the teeth, and it's going to helping you to keep the surface of the teeth clean. The greenies. Greenies are a good product to use. The dogs tend to like it, and they are effective for helping you to control the tart in the teeth. And that's something that I will recommend you to use. There is the Veterinary Oral Health Council, which is a group of veterinarians that specialize in dental care. So that's a good source of information when you are trying to look for products that you can use for your pet. They usually do a little bit of the research for those products, and they list it. The ones that are in the website that they have and they are listed, they tend to be safe. They usually has been reviewed by veterinarians, so it's a product that you can safely use it for your pet at home.
And I'll be sharing the link in our chat at the end of the slideshow, so you guys can take a look for yourselves.
Yeah.
Again, always asking your vet, but as Dr. Baquero says, the Veterinary Oral Health Council is awesome. So
yeah. So we talked about diets before. Diets are important. The diets will combine. They usually have something that is called sodium triple phosphate. It's a chemical that they use in the food, and what it does is avoid the calcium into the saliva of the dog, and that will help you because the calcium is needed to form the tartar. So the dental diets will have that into, as we were talking before, they have glucosamine chondroitin 2, and they usually have the fatty acids, which is an anti-inflammatory for them. So with the diets, you will have a little bit more benefit because it's not only going to benefit the teeth, but it's also going to benefit the joints, and it's going to benefit the skin. What I find in the practice that happen with the dental diet is sometimes they're hard for them to eat it, and they cannot chew on that. They also have two different types. They have the small bites, and they have the regular bites. So you have to see which one do you want to use, and those should be according to the size of your dog, so they can use it. And again, the toys, any of those chew toys that you can use for them to chew is good for them because it's an activity that they can do, and it's also something that will help you to clean the teeth.
We have Mitchell that wants to know about bully sticks. What's your thoughts on bully sticks?
Bully sticks?
Do you know what that is?
No, I'm not familiar with that product.
Okay, Mike, I'll show you an article afterwards offline, and then you can make a decision on that.
Okay. But is something that is designed for them to chew?
It's actually the cartilage in the bull penis that they give to the dogs. They dry it out, and then the dogs chew on it. But I've seen actually a dog swallow the whole thing whole.
It is like some people use the pig ears,
Yes, it's the same concept.
It's the same kind of product. And sometimes I wouldn't recommend you to use any of the hooves of the cows. That's the other thing that sometimes you go to the pet store and they sell it. Those products, first of all, if your dog has any kind of issues with allergies and you're giving that, then you will have issues with the skin and they may have diarrhea. The other thing that we can see with them, sometimes, especially big dogs, can take a piece out of them. If they can take a piece or if they can break it in bigger pieces, they can swallow those and they can become a foreign body. I have been seeing dogs that the bones, I don't know exactly. I think some supermarkets will sell pieces of bone for the dogs to chew. I was in an emergency one time and a bulldog swallowed the whole piece. It went to his esophagus, but because of the size, it wouldn't be able to go to his stomach. It was in the pylorus. When it comes to surgery, that area is a very hard area to do surgery. So that dog ended up having an endoscopy to have that piece retrieved from his esophagus, and that's expensive. So it's something that I always tell people, be very careful with those kind of products, especially when you have a large big dog, because they can swallow it complete or they can break it into pieces and swallow it. And then you ending up having to do a surgery for a foreign body to retrieve those pieces out of the dog. The other thing is allergies. A lot of the dogs can have allergies to those products, especially bulldogs. Remember, bulldogs are very sensitive. So that's what I will say when it comes to those products, because that's what is more commonly to see it in practice, you know.
Yeah, they could clean the teeth at the same time they were taking the foreign body out, Mitch.
Mm-hmm. Yeah.
Just saying, that's just a joke. It's just a terrible joke, but yeah.
Yeah.
He's laughing.
Do you have any other questions?
We had one question that it was about the greenies, and then another one was about the toothpaste, what recommendations. So the reason why we tell you to go to the veterinarian is it's important to ask your veterinarian what products he uses and what, or she, and what products they carry and what products they sell at the hospital, because there's two reasons. Because we know they're safe, like Dr. Baquero was saying, and then we know they've been studied. But not only that, if you decide, well, I'm going to go online and buy them because they're cheaper on Amazon or Chewy, those products can and have been bootlegged, and they sell them as the direct product that you think you're buying, and they turn out to be something completely different from Canada or from Bolivia, or what was that other?
I'm going to tell you. You remember I talked to you about the NexGard experience?
Yes. Yeah. Where was that produced?
In Brazil. Let me tell you what happened. I see a dog 2 days after the owner giving NexGard because the dog was having vomit and diarrhea. We run some blood work and the dog was having kidney failure. Because usually in practice, when we have products like NexGard or Bravecto, the companies tend to backing up the products when the animal have any kind of health issue. I told the owner, can you do me a favor? I asked him, where did he buy it? He said, I bought it in Amazon. So I told him, can you do me a favor? Can you bring me the box so I can contact the manufacturer for the manufacturer to kind of get into and pay for the treatment of the dog, because it was his product, you know. It's 2 days after he gave the NexGard. So when he brought me the box of the NexGard, what the product was made in Brazil. And NexGard, I don't know if there is made in Brazil, but in the US, the one that we sell here is not made in Brazil. So I contact the rep for the NexGard, and they say that they have a lot of products from NexGard and Bravecto and all of the Pliantic products that they are selling online that they are not original. There is somebody else that is making it and putting it online. So that's the reason that the company is not doing any backing up for those products. They also told me that usually they will backing up the products that they can trace back. It means that they sell it, for example, to your veterinarian has the invoice and they can show that first the veterinarian bought it and then you bought it. So they can trace back the product. When the product is tracing back, then if something happened to your pet, those companies will back it up and will pay for all the veterinary care that we have to do for that pet. But when you go to the pharmacy online, because they cannot do this tracing back to you, they wouldn't back it up the product that you buy. So that's important for you as an owner to have in an account, because then you ending out, and that's major. The dog never recovered. She's in fluids, she's on a special diet. And it was because the person decided to buy a product online, you know. So try to, as I explained to you, this the veterinary field is changing and changing really fast. We're having a lot of people that is trying to making money out of this business, and it's unfortunately, because for me as a veterinarian and for you as an owner, there is a lot of information that is not correct. And there is a lot of people that tell you things that are not real, or try to sell you something that they say that is original, and when you try to see, it's not an original product, you know. That's what I would say. So just try to be careful, you know. So do you have any other questions for me?
I think there was one more question that was, let me read it. So if a dog is on a fresh diet, a human grade, does that impact their teeth? They don't need to chew on that food very much because it's fresh food. So I think the question is, what else can they do?
Then if they do using that kind of food, the toothbrushing will be ideal. If they can brush the teeth after he eat that meal, it will be ideal to do that, you know. Because remember, sometimes when they eat the dry food, because of the mechanical action of the dry food, they can help a little bit with the teeth. But if you're using some kind of cat food, some kind of canned food, or you're using fresh food, the idea will be to brush the teeth after you use those products, you know. That would be my recommendation.
And the water additive maybe too, because most dogs drink after they're done eating. I think that was...
For the greenies, the only thing that I have with the greenies, I tell you, long time before, like probably let's say 10 years ago, they have to reformulate the greenies, because especially for the large breed dog, we were encountering that they will be able to break it in 2 parts and they will swallow the greenie. And we ended up I did a couple exploratory surgeries because of that. So the company reformulated the product. The product nowadays is better. The only thing is, as an owner, make sure you know the body weight of your dog, of the size of your dog when you buy the greenie. Because if you buy something smaller, they can either break it apart or they can swallow it whole. So that's when you go and buy greenies, you see it's different sizes. It is important for you to buy the right size for your pet. That's the only thing that I will say about greenies. They are good. They are easy to use. The pets love it. But the only thing is make sure it's the right size. Okay?
Let me see, we have another question here. What if I buy the adequate size for my dog and he still barely chews it? Then you're in trouble. You got to get a bigger dog or a smaller dog. I'm just kidding.
No, sometimes it's the same thing that we were talking tonight. A lot of the dental care comes from training. If you can train your dog to do brushing, it's ideal. If you don't, then you have to see which kind of, if he doesn't like the greenies, he probably will like another chew toy. You know, you can buy something different that is chewable. We have the CTA chews, which they have chlorhexidine on it. They are pretty safe because usually even if the dog swallow a whole, in 24 hours, they would dissolve. So it's not any risk for having a foreign body. Again, they come in sizes, and sizes are important when it comes to chew toys for the dental treatment. So buy the right size. They also tend to have like this dental food, the dental diet that I was talking, they put some additives. And those additives will help you to control the amount of bacteria inside of the mouth, but it also helps to control the amount of calcium in the saliva of the dog. And that's going to contribute not to develop so much tar in the teeth. So those are products that usually you can find in a veterinary office, and it's something that it can help you to do the maintenance of the teeth. It's just a matter of see which one is the one that you dog like, you know.
Or which one the dog tolerate. I think one of the important things is we keep getting questions about products, and it's important. You can get anything over the counter. You can get anything without a prescription pretty much. I mean, except for heartworm preventative and things like that. But if you have a relationship with your veterinarian, you can call the office and say, hey, I need to pick up some toothpaste and a toothbrush. You know, and then they'll get it ready for you. They're not going to really want to, unless you haven't been there in over a year, and then they're going to want to see the pet. Or, you know, Dr. Baquero has the new clinic over there by the falls. I don't know if anybody's near there or not, and then the dental package that she has, I'm not selling it. I'm not pushing it, but if you need a dental cleaning, ask Frankie about it. The package that she has is super fair. It's super good. And she does everything that any other clinic is going to do. And she also has the products that you might want to go through and look at and see if there's something. And even if you don't need a dental yet, get to the veterinarian and let them have a look. I wonder how many people on here go to the vet annually just for a checkup? If you're on a 3-year vaccine regimen now, do you go to the clinic once a year? Can anybody answer that in the chat?
I usually,
Um,
I think like
go
a
ahead.
little less, but that's because we pay for, like, we have like the Banfield wellness plan for him.
Okay.
They're like every 6 months, they're like, oh, you're due for whatever, but he's a healthy dog, so I don't know why.
Okay.
we do
Katie
that.
says she goes once a year. Does anybody go more than once a year?
I go more than
Twice
once.
a year. Jason goes twice a year. Oh yeah, you go more than yeah.
I go all the
Yeah.
time, guys, because I have small dogs, and it's something that I think is very important to note for anyone who is thinking about getting a small dog. And my small dog people here, Miss Gracie. I have a Chiweenie. You guys know Nutmeg. His teeth have been awful for forever, and it's something that I personally didn't brush his teeth every day. I wish I had. Like, I wish I'd met Dr. Baquero like earlier and had this presentation, because it does make a difference. And once the dental is done, from what I understand, we have to wait a week to brush the teeth.
Yes, because remember something, when we do dental cleans, we're going to clean what you see outside of the teeth, but we also go underneath the gum lines. If it's anything else over there, we will remove the tartar over there too.
See,
So
that
they
to me
can
was
be a
so
little bit sensitive the
Right.
following week. So at that time, we should probably wait a week for them to have any kind of dental care done. Mhm.
like we don't know that there's 60% of the teeth is underneath the gum, and that's why before seeing this presentation or just like reading up on my own, I was okay with the non-anesthetic dental. Like, it seemed like a good idea to me, like, great, like no anesthesia, the dogs are fine, like their teeth look so pretty, but like seeing that you're actually not taking care of like the main issue, and it's really changed my mind on that, and I can tell you that, like, I just had Nutmeg. He had 9 teeth removed. It's like Dr. Baquero, you said, it's also about the breed, and he's a Chihuahua / Dachshund, so it makes a big difference. Like, he had teeth that were on top of, like, he had retained some teeth, like we mentioned, like little dogs and little cats, they have those issues. But like, I was gonna just do a non-anesthetic, and I'm really glad that I went to my doctor and I was like, hey, like, let's do this, because he stopped having behaviors that I did not know were associated with maybe mouth pain. Like, he would always lick his paws, and I thought it was allergies, but now he's not. He's not doing a lot of self-soothing things that I thought, and I was treating him for allergies. So I don't know if like you can talk to that, maybe like some things that like you said, like there's some symptoms that, I don't know, there's so many things that you benefit with or from like having a dental. Like, I'm super happy I did it. So
Yeah.
As we were talking about it, because you can only see only the 40% of the tooth out of the gum line. There is a lot of diseases that are underneath that you cannot see it. That's the importance when you do a dental cleaning to have X-rays done. That's an important part of the dental procedure. Because if you don't do that, then you are just cleaning the outside part, but you cannot evaluate what is going on underneath.
And they might still have pain, and you think you did a great job, and you're like, look, you look so pretty, and you haven't taken care of it.
Exactly.
Right.
So
And
that's
how many people, like, if you can raise your hand in the chat if you know how to raise your hand, but I want to know how many people let their dog kiss them. I do.
You put your
And
hands
how
right.
Yes, I think everybody else does that.
how bad is the breath? I mean, if their teeth are clean, it's way better for you as well. Yeah, it's way better for you.
Yeah.
Mitch wanted to know about braces for dogs, but we don't do braces for dogs because they won't wear the retainer afterwards.
Yeah, I think we have a specialist here. It's Dr. Balos.
Yeah.
And Dr. Balos, as we were talking about puppies, it is important that they are evaluated when they are really young, because I was explaining to you. I see a lot of, again, it's up to the breeds. English Bulldogs, French Bulldogs, Chihuahuas, Yorkies, Maltese, especially the small breeds, like she said, that they tend to have a lot of abnormalities in the teeth, and they start when they are really young. sometimes they have the teeth all together or have the roots very close together. And what they need is when they are less than a year, they may be able to put some of the teeth out. And then when the other teeth develop, they are going to be healthy, you know. So for puppies under the year old, it's important to evaluate that part and see if the teeth are in the right position and see if they have enough space. And sometimes I see people that bring me the animal and say, oh, he never have the premolars, or the premolars never came out. And they think that the dog doesn't have it. And sometimes it's stuck into the bone. And over the period of time when they are 2 or 3 years old, they develop an abscess. And it's because that teeth was in a wrong position and is growing in the wrong direction. And because nobody else did the exercise of the mouth, nobody else knew that that was going on inside of his mouth, you know. So in young animals, even though before the year, it is important to try to evaluate what is going on with those teeth inside. Because there are things that you can correct at that age that is going to be beneficial for the rest of their life, you know.
Wow. So to recap, I guess we'll the preventative care is your top of the list.
Exactly.
Care, take care, and puppies, teach them how. Middle age, get them in. Older dogs, get them in now, get them checked, get blood work done, and then get those teeth cleaned, and then you know, weigh the older dog health issues, do the pros and cons of it, and go over it with your veterinarian, and then see what's best for the pet. They'll live longer, they'll live happier, they'll live healthier if they have a clean mouth, and they won't smell so bad. And also, you know, sometimes if you go in, you thinking the dog has bad breath, and you go get them checked thinking it's their teeth, and then there's other things that they find out that there's kidney issues or liver issues that are causing that smell, and you can save the dog that way too by finding it early. So there's a lot of benefits for getting the mouth and the smell checked. So be mindful of anything and any changes in your dog or cat. If they're, you know, pawing at their mouth, or they cry out when they eat, and you can't see anything, but to get them in and get them checked out. And
or if they stop eating too, like if it's hard for them to chew on kibble that they were okay with chewing before. I found anytime a dog or cat stops eating, that's a red flag for anything. So that's important to remember. Like, oh, he stopped eating yesterday, but really he stopped eating a week ago and you didn't notice. So anytime they stop eating, that's a key indicator that something's wrong, whether it's teeth or kidneys or anything.
Any kind of secretion coming out of the mouth, you know. Sometimes they have the saliva a little bit red or brown, or it's in a different color, you know. And like you say, the bad breath is something that it should be addressed, because it could be either the teeth or something else more going on for them, you know.
Yeah.
So I didn't know that bad breath was not normal for dogs. Like, you know, you're like, oh, puppy breath, dog breath. And so this is super enlightening for that reason as well. And now that I think about it, cat breath, you know, like I know we didn't cover cats too much, but, you know, you can also brush your cat's teeth, I imagine, a lot more carefully. But, you know.
It's important. That's super important. Cats don't show it for a long time, and then they'll get, most of the time when you go in to do a dental on, at least in my experience, when you go to do a dental on a cat, there's always one fractured tooth somewhere, either from too much tartar on it, or from gum disease, and the tooth weakens and then it fractures. And so a lot of times, 9 out of 10 times when you get your cat's teeth cleaned at an older age, you're gonna have to pull some teeth.
I did see they have greenies for cats, and they're smaller. They're crunchy compared to like the regular greenies.
You know, cats really like them too. You throw them across the room, they'll go running after it, and you make a game out of it. It's fun. Yeah. Is there any other questions that we can answer while we're here?
Anything specific to your doggies?
Does anyone have a Yorkie on this chat?
No, I don't think so.
No, because Yorkies have a bad mouth. Chihuahuas too, and smaller dogs, but
Malteses.
Yeah.
Oh yeah, your Maltese. I did want to say for the toothpaste, they should have enzymes in them.
Yes,
like when you go,
be an enzymatic toothpaste. Yeah. because
Yeah.
that is going to, again, we come back to the plague.
Mhm.
If you use an enzymatic toothpaste, because it's a protein layer, if you use the toothpaste, an enzymatic toothpaste is going to remove that. Once you remove that, because it doesn't have like the sustain for the calcium to build up on top,
Mhm.
then it is going to help you a lot with that.
Got it.
Yeah.
Mhm.